define healthcare. I'm serious. You keep saying it's not medical care, it's healthcare.
No.
Tell me what
Okay,
you're.
well,
I'm curious. Tell me.
Healthcare
I don't
is
understand what you're saying about
healthcare is not a chemical drugs. It's not surgery. It's not emergency medicine. It's not broken bones. It is, well, for instance, you have several people at several different professions of healthcare.
Are you talking wellness?
You have, well, wellness, but wellness is a thing where the medical people say, you go home, you stop smoking, you eat right. Oh, eat right, okay. You lose weight, and that'll solve all your problems. That's it.
And it could.
Well, it could, but, I mean, how many do?
That's right.
I mean, you need professional help to do that. And what you have, and you have back pain, you have all types of ailments that can be taken care of through health. You have the naturopathic physician, you have the chiropractor, you have the Chinese medicine doctor, you have all types of alternative medicine that has been discredited, but in reality does wonderful things.
Okay,
And
so you're talking about that umbrella of
an umbrella
healthcare
of
professionals is
alternative,
healthcare.
an
It's called
alternative medicine board, but you could call it something else. You know, why call it an alternative? To me, healthcare providers are not an alternative; they're a requirement. But for instance, the naturopathic physician, he's the one in that group that can diagnose, like a family practice doctor. He has similar training and a similar number of hours in medical college. They can work with, they'll examine your blood and diagnose your body and balance you out. Rather than go after the symptom, they go after the cause. And this works. If it's not always going to work, there's going to be sometimes mistakes, or you have to call in the medical people. But the two systems should operate individually, because when you have the medical people, the allopathic doctor, telling the naturopathic doctor what to do, he loses his effectiveness. So they have to work independently on their own recognizances and then integrate. If every office, doctor's office, had a naturopathic doctor, an allopath, a naturopath, chiropractor, that type of mixture, instead of nothing but medicine. But if we had all those there, we would change the whole thing.
Well, I have a comment and then a question. My question's not going to be very popular, I'm sure of that. But Walt, when you said we need to increase the number of physicians, that's absolutely true. You know, and if we had more physicians and more access, the cost would indeed come down. I think we know that. But one of the things that we're talking about, my question here, one of the things we were talking about health care is, this doesn't sound very humane, it doesn't sound very democratic, and I don't mean for it to at all. But does anybody ever talk about limiting services? I think sometimes, particularly, we have, that's mine, excuse it, I don't know how to turn it off. I don't have vibrating, it just rings. For instance, we have babies born at 22 weeks.
Yeah.
Well, we have the means to keep those children alive, or sometimes we keep them. There was a baby recently, the mother was killed and the baby lived for 4 months or something and then died. My guess would be that that baby probably cost the system a couple of $1 million. My daughter's a neonatal intensive care unit nurse in Kansas City, you know, and she talks about babies that come in, and when we have babies born that early, even if they survive, the ramifications for their lives, and it recently has said not only their lives but their children, that they will probably have premature children. Does anybody ever give thoughts to, are we at some time going to say, we're not going to save 22-week children or 24-week children? I mean, I know that sounds awful, and people are probably saying, this woman's Hitler. We understand that. And I understand too, but you know, even when these babies survive past the initial, unless they really have intelligent, sophisticated parents,
They're not.
their lives are not going to be very productive. And then we're also paying for that. I just throw that out because I think it's something that we have to be thinking about, even with the elderly, and I'm getting to be one of those. Is there a point where we quit saying, let's keep you alive forever and ever and ever?
If the family member is standing there and saying, take care of mom, keep doing this, the medical professional have no choice but to do that. And yes, we have the ability to create literally miracles. But you do have to step back and say, just because we can do this, is it really
Absolutely.
the right thing to do? Because, and this is going to sound cold and inhumane too, but somebody has to pay for it.
Oh,
Unless you're going to find this brilliant scientist doctor that's willing to do that procedure for free and a facility that's willing to give it for free, we can't give transplants and nerve regeneration and whatever might be the latest intervention that they've come up with.
We'll let Delia respond to the political aspect of something like that.
Oh, sure.
And it may be a total different answer what you just said. And let me also note that actually tried to happen. And I have to say it because that's what happened. The Republican leadership in my Health and Human Services Committee, Representative Landwehr is the chair, and then another person who's a surgeon, went and just circumvented the whole thing, redid a whole new bill. And one of the things that they had did, which infuriated me, and we called them out on this, and when we were working the bill, is they wanted to limit, which has changed, but they initially tried to take out, this is how it went. You have 2 years of any health liability that you may have had, and they were going to come up with a liability definition. For example, if you were overweight, you had 2 years to lose the weight. And it doesn't matter if you got on or got off, got on and off. If at the end of that 2 years, when they set the starting point, you didn't lose it, and then you started getting diabetic problems, hypertension, they were not going to pay for that. And then the COBRA would kick in. And that's assuming people could afford to pay for the COBRA. The people that I represent, I have a lot of low-income people who can't do that, and I'm not going to go back to my position and say, oh, sorry. And when I did ask my colleague, what about those people who can't afford it, he says, well, quote unquote, that's just unfortunate.
That's what?
That's just unfortunate.
I can't, it doesn't matter. So this goes back to something I feel very strongly and passionate about, which is why I requested from day one, the year that I got elected in 2004, to be put on House Committee is we need to be proactive and preventative measures. And that's something that I'm going through myself with, my weight management, yo-yoing, but, and seeing, what Commissioner Wellshine was talking about, the holistic part, from eating healthy, from having a healthy lifestyle, not just taking pills. So anyways, that was a huge discussion point.